The time is now 8:15 and doctors are now recommending women schedule their mammograms before or after a few weeks after receiving their a few weeks before, I should say, or a few weeks after receiving their COVID-19 vaccine. It's all about the body's immune response to the vaccine, but here to explain exactly what it is we're talking about here, we have Dr. Treil, an OB/GYN from Touro, to explain why there's this new recommendation surrounding the timeline of you getting your mammogram and your COVID-19 vaccine. Doctor, we appreciate you being with us this morning.
Good morning. Thanks for having me.
So tell us what this new timeline is that you all are recommending, and tell us why.
So generally speaking, when you get your COVID vaccine, the immune response that your body generates, which is a great thing, sometimes causes some lymph node swelling. Sometimes when you get a cold, you'll have swollen lymph nodes in your neck. You'll have other lymph nodes that swell, right? That's just a great immune response. So it's a good sign that your vaccine's working. The issue with surrounding mammograms is that in the arm that you get dated in, sometimes you'll see some swelling in the lymph nodes under the arm. Again, not a major issue, and it's not that you are developing cancer or whatnot, but what it does is it confuses the picture for the radiologist who's reading your mammogram. So if they don't realize that you've gotten a vaccine recently, they may look at those images and see or think that they see some signs of cancer, even though it's not really cancer. What that then does is creates unnecessary follow-ups. It creates a lot of anxiety for the patient that there's something wrong when there really isn't.
And have you personally treated patients who have gotten their COVID vaccine and then pretty soon after gotten a mammogram and had to get biopsies because of this confusion?
Yes, we're seeing that. As with everything with COVID, there's new information coming out all the time, and this was one of those unexpected follow-ups that's happened with the vaccinations. Again, a great immune response, but we're seeing these kind of changes in the mammogram, which can cause some unnecessary concern for the patient.
So just give it a few weeks, either get your mammogram before first and then get your shot, or get your shot and wait a few weeks before getting your mammogram.
Right.
We have about a minute left, Doctor. I'm sorry, go ahead.
I would say wait probably about 4 to 6 weeks after that mammogram, just so that it gives those lymph nodes a chance to kind of decrease as well.
We have less than a minute left to chat here, and I know the one thing you wanted to get across was the importance of still getting your treatment, but also when you get the chance to get the COVID vaccine, go ahead and get that.
Absolutely. Take every opportunity that you can to continue to do your routine screenings, continue to go to your vaccinations. We've made everything completely safe and reduced risk for patients tremendously over the last year now that we've been dealing with this pandemic. So I would encourage patients to not delay their routine care or their COVID vaccinations.
Just put some space in between that care, specifically mammograms and those COVID vaccines.
Absolutely.
Dr. Treil, we appreciate your time this morning. A good not reminder, a good piece of advice that again we're learning every day as we move through this pandemic. So we appreciate your time this morning.
Absolutely. Thank you for having me.